Fantastic. Where are you joining us from?
Los Angeles, California, little town called Beverly Hills.
Nice, nice. Really keen for you to bring the listeners up to speed with how you've arrived at what you're doing today.
Yeah, I have a little bit of a unconventional way I arrived to working in hyperbaric medicine. I was actually a commercial diver and a dive medic. And so in dive medicine and commercial diving, we use hyperbarics to treat dive injuries. And so from there, it's just kind of evolved. I did a lot of work in trauma at the hospitals. I did some traumatic brain injury research. And then I went on to open a few hundred different hospital based clinics here in the States before finally opening my own center here in Los Angeles.
Beautiful, beautiful. And so, from a dive perspective, what's the outcome in terms of like, as far as I understand, if you go to the surface too quickly, nitrogen dissolves in your blood. Is that right? And is the by putting them back under pressure, it takes the nitrogen out of the blood. I could be getting all this muddled up, but and then you slowly release the pressure as they should have when they were going to the surface. Is that how yeah,
Yeah, you have the
yeah.
basics down. When you're diving, you're breathing compressed gases, and our body can't use the nitrogen in those compressed gases. So if you come up too quickly, those little bubbles come out of solution. So think of like when you
Okay.
open a soda and you see the little bubbles that seem to form out of nowhere. That's the idea of what decompression sickness is.
Ah,
So when we put you in a hyperbaric chamber, we squish that bubble back down, and then
okay.
we bring you out slowly and controlled so it comes out the normal way through breathing versus kind of coming out in your blood and creating a little blockage in your body.
Right, okay. Okay, so you've got these air bubbles, yeah, that are gonna cause, concern,
Yeah.
yeah, circulating around the body. And what happened? I mean, you die if you don't get this support, right? Is that what happens, or How would it manifest in the body? These nitrogen bubbles in
Yeah,
the
so the
blood. Yeah.
longer you dive or the deeper you go, the more that's dissolving in your body fluids. And
Hmm.
so we have decompression tables available now. Each country usually has their own version. They're pretty similar of if I dive, say, for 60 minutes to 60 feet seawater or, roughly 20 meters, I should be okay and come to the surface at a normal rate. But if I do that same dive for maybe 2 hours, then I need to stop partway up and just sit in the water column at a certain depth and breathe. And you're allowing the bubbles to come out at that depth. So going back to that soda analogy, you have a soda that was shaken up, you kind of recap it real quick, let it calm
Hmm.
down. That's a
Okay.
decompression stop.
Yeah.
And then when it's calmed down, you can slowly open it back up. And so that's what appropriate decompression would look like.
Right, right. So, and then what was the thinking in terms of like you obviously you call it a hyperbaric medic, right? So you help people through this decompression. What was the thinking in terms of like how did you then think, oh, this could help people in hospital? Like, where's that link? Like,
Yeah, I was not the one who originated that. I did get recruited to the hospital because of my background, but they actually used to have hyperbaric hospitals, and people would go live in a hyperbaric hospital because you get so much benefits from all the increased oxygen. Because when you're in a hyperbaric chamber, just like diving, you're breathing dissolved gases. We just give you oxygen instead of air. So we take out that decompression risk for the most part because your body will use that oxygen. And your body uses all that extra oxygen to heal things. And so in hospitals today, we use it to heal things like radiation injuries, diabetic wounds. If you had a surgery and it's not healing very well, it's the only thing in medicine we actually have that will regrow new blood vessels. And so, in the 1800s, they used to just put everyone in the hyperbaric hospital for a couple weeks and they'd come out better. Over time, they realized we can just put you in for a couple hours and you do a series of them instead of having to live in a giant hospital for 2 weeks that's compressed because you're basically becoming like a saturation diver at that point. You can't really come out, you have to live there for 2 weeks. So,
right.
through advancements, we figured out we can tweak it a little and you don't have to be there so long.
Right. So it really helps with the inflammation side. Is that one of the areas it support? Also energy production, right? Given that we need oxygen to combust fuel and create energy. So I assume if we've got good amounts of oxygen getting to our tissues, we can generate energy for the healing process.
Y
Is
Yeah,
that
absolutely.
yeah?
It's a really potent anti-inflammatory. A lot of our patients come here and they may not be coming here for its anti-inflammatory effects, but they'll end up going off like arthritis medications while they're coming. It's such a potent anti-inflammatory. Our athletes really love it for that. And then, yeah, because you're getting more oxygenated, you start sleeping better, your energy production gets better. It's actually got some bacteriostatic and antiviral effects. The oxygen tensions are too high for those to be able to reproduce. So, if you're fighting any infections or coming off of being sick, we can really accelerate your healing process.
Right. Okay. Okay. And you said it also helps angiogenesis in terms of the regeneration of blood vessels and
Yes.
to help that wound heal or the scar or the surgery. After surgery, I can imagine it'd be quite good post surgery.
Yeah, it's really excellent after surgery because if you think about it, any surgery is cutting the blood supply
Mm,
to the area that they're trying to improve. So now you're trying to heal something that had surgery, but it's got a diminished
mm,
oxygen supply. So we
yeah.
can, when we put you in the chamber, we're immediately flooding that area with oxygen, and your body's using that right now. And then through doing a series, you get that high oxygen tension when you're in there, and then it goes back to normal because we go back to the world outside without pressure and oxygen. And that's what stimulates that process is that sharp rise and sharp fall. And that's why you usually do a series of these.
Hmm. And can it be localized to an area, or do you need your whole body goes in the chamber and therefore your whole body's exposed, or is there devices that can help just localize that particular area that got surgery?
No, that's a good question. The only way to get the oxygen effectively in your body is through breathing. So your whole body has to be pressurized.
Yep.
They've
Okay.
tried little localized like foot compartment or arm chambers, but you don't absorb the oxygen through your skin. You still
Yep.
get it through breathing.
Okay.
So the positive of that is you may be hoping to heal a surgery faster, but since your whole body's getting the therapy, your whole body's getting the benefit. So you get lots of happy side effects, and your whole body gets the benefit.
Yeah. 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 Because it goes to wherever it's needed most. Like the
Yeah.
yeah. Yeah. Um, yeah. I was just thinking, in terms of the radiation support, it's helping the regeneration of, I guess, new tissues and or cells, and that create tissues, and helping that healing process as well.
Yeah, with
And
radiation, it's a challenge because they're trying to kill the cancer and the blood
hmm
supply to it, but the surrounding tissue often is very
hmm
adversely affected. And so once you're through that process, we can put you in to reverse the damage.
hmm
The tissue becomes kind of what they call fibrotic. And so if you get any cuts there, it's never going to want to heal.
right.
It's got a different texture than the rest of your tissue. For people who had radiation near the bone, a lot of time the bone starts to die because it's not getting enough oxygen. It's already got a very low supply to begin with. So we put you in the hyperbaric chamber, we reverse all that, we reestablish that blood supply so it becomes more normal again.
Right. Okay. Okay. And then the athletes, they're seeking performance based, peak performance, and it's really helping them recover from training, like the hard training sessions, and gets their muscles recuperating quicker so that they can train more, sort of, or with less breaks between training. Is that the sort of why athlete?
Absolutely.
Yeah. Yeah.
Yeah, and we have a lot of boxers that use it to try and prevent CTE long term. Our athletes definitely use it because if they can train sooner and faster, they're getting the edge on their competitors. Also, just to repair in general. Some athletes take it a step further and they'll sleep in a hypobaric chamber, so like a reduced altitude room. And if you sleep in that for at least 10 hours, your body naturally produces more red blood cells to help compensate. And so you have more oxygen available to you on the field or the court. But the adverse side effects of that is you have less oxygen during your primary healing time, which is when you sleep. So they're a bit more prone to injuries. So they will usually balance that process with getting in the hyperbaric chamber to heal.
Yeah. Okay. Okay. So it's finding that balance in terms
Yeah.
of meeting their needs around what they most need. And yeah, yeah. Okay. So it's very popular, I can imagine, with athletes to get that competitive edge.
Yeah, absolutely.
And where have you seen the most aha, like, sort of changes? Like, share some stories about some clients that have come in to get support, and you've taken them through the hyperbaric medicine or therapy, and you've just seen incredible improvements. Please, yeah, talk to us about that.
Yeah, one big area that we're seeing a lot of assistance in is in brain health and brain metabolism. We did have one very sweet lady who came in. She had a wound on her foot that just would not heal. Um, but she didn't, we have, it's kind of called like a failure to thrive. She didn't really have the desire to do anything in life anymore. She wouldn't dress herself. She didn't feed herself. And she came in for a series of treatments. And not only did we heal her foot in that process, but by the time she finished treatment, instead of getting wheeled in a wheelchair, she came in, pushed her walker aside because she was now walking, and rang the bell. We have a bell that when you finish treatment, she rang it so hard she ripped it out of the wall. So she was just so excited. Her family was just astounded at the benefits because a lot of the dementia symptoms seemed to have dissolved. And
Wow.
so obviously that wasn't what we were primarily treating her for, but to see that and the quality of life she got back for those years that she has now was, I mean, that was untouchable.
And that'd be quite similar to the CTE that you spoke about earlier with boxers, is that they get particular trauma damage to an area of the brain, and it really it's it's hard to I guess help it to heal. And this is a way in which the body does the work itself through what you're supplying in terms of making sure there's adequate oxygen getting to the area, so it can regenerate and that neuroplasticity kick into gear.
Yeah, exactly. I mean, the mechanism of action for both of those things is really similar to what we're treating even in the wound of the foot. A lot of times, the reason you're having those symptoms is some part of the brain is not getting all of the oxygen. And
Yeah.
so by putting you in the hyperbaric chamber, we're flooding it with oxygen while you're in there. It immediately starts kicking things into action. And then through that series, we regrow the blood supply over time. And so a lot of dementia and Alzheimer's is sometimes caused by little micro strokes that you don't really see. You may not pick up on them. They're so small, but they're still stopping the blood supply from reaching its next point. Same with CTE, that's usually from trauma. You've broken those little blood vessels from trauma. Now we're reestablishing that blood supply and kind of reversing that process.
Yeah, wow. I was thinking, is there a particular area that you've seen results that you thought, "I will just try it"? Like, you weren't quite sure whether it would help, and then you thought, "I'll give it a go," and then you thought, "Oh, wow, it helps that." Like, is there anything like that?
Well, when we're looking to treat people, at least here at our clinic, because we are very hospital guideline followed, the states are pretty restricted on what they consider allowable indications and not. Um, Sometimes that can be a little rigid, and so we don't always get to see those things. So a lot of our shocks are these patients that came in for one thing and end up finding out, oh, this is no longer needed.
Ah,
And so we get patients coming in saying, I didn't tell you this, but I was getting injections in my eye every other month because the pressures were too high and I was losing my vision. And the doctors are like, I don't know what you're doing, but keep doing it. You don't need them anymore.
yeah.
Or we've known there is some research that it can help with glaucoma, but the research that we've had has been kind of limited, showing that it can help reduce the tensions, but it's kind of like taking your eye drops every day. You'd have to go in every day. So is that feasible or should we just do the eye drops?
Yeah.
What we're seeing is people are coming back saying the hole in my vision that was permanently lost before I found this diagnosis is getting smaller. And so their eye exams are proving that they're regaining vision when they've been told that's not possible. And
Wow.
so those are some of the exciting kind of emerging fields of no one thought it was possible, yet the data showing it is. Let's do more research.
Wow. So there's a couple of areas you mentioned, such as the brain and the eyes, which is an extension of the brain. But both those areas are really demanding in terms of energy. They require huge amounts of energy, and I can see how this is really supporting that area because of the energy needs of the brain and the eyes. I was just thinking of the heart because that's another energy dense organ. And have you seen or do you treat anything associated like with heart disease or um,
We're not specifically treating any sort of heart disease currently. It's not like a widely spread indication. I will tell you the people that have like reduced ejection fractures and even COPD, just don't oxygenate well in general, feel a lot better when they're undergoing therapy because they're getting the oxygen they wouldn't be otherwise.
yeah, yeah,
And so for them, it's a lot of quality of life. Um, And it's important to note when you're looking at hyperbarics and how it can regrow those blood vessels, it's regrowing the small ones. So if you have a
Mhm.
major artery or a major vein that's blocked, usually we're going to send you for a surgical intervention or a bypass. Once the main blood supply is established, then we can work on some of the smaller vessels.
Yeah, wow, wow. And in terms of accessibility, I don't assume these machines are cheap, right? They're a big investment. And like I can see hospitals, they invest a lot into equipment, and it's probably, it probably just fits in with everything else they have in the hospital. Obviously, you've made a big investment here, and how do the clients pay? Like they pay per session, or do they get a pass, like a membership, and they can, or yeah. So how's it accessible here in Beverly Hills?
Yeah.
Yeah.
So we are fully Medicare approved and insurance approved. So if you meet those qualifying indications, we work with those to get payment from the insurance company. However, if you don't, we usually do packages. And I think that's pretty true most places around the world. Um, in Europe for sure, in Canada, if it meets the indications, the system will pay for it. If it doesn't, then it's cash based. And usually you want to do a package unless you're treating decompression sickness or a gas embolism from diving. Everything else needs a series. You're not looking at one. It's a remarkable therapy. It's extremely non invasive, but it is just oxygen. We're just manipulating how we get it in your body, and your body has to do all the work, and that takes time.
And what sort of proportion, like if you can give me some sort of percentages of people seeing you, like, that are athletes, people that are seeing you for CTE, people that are seeing you for the support around they've risen, scuba diving incident. Yeah. So what's that sort of breakdown, that customer profile that is using this treatment?
Yeah, I mean, at our facility, I think it's a little more heavily surgical than most facilities in the country, but that's because we are in the plastic surgery capital of the world, so to
Yeah.
speak. Um, about 10% right now are brain injuries. That's not a fully approved indication yet in the States, but a lot of private insurance companies are recognizing it, so they're opting to pay for it anyways because it's preventing longer term damage for those individuals. Probably about 50% are surgical
Mm.
and about 25% are cancer or radiation based.
Okay.
We'll also use it in conjunction with chemotherapy to help mitigate some of the side effects. So we'll work with the oncologist or some of the other alternative therapy doctors to time hyperbarics versus doses and things like that. And then the other 10-15% like wounds, infections. We have a lot of people starting to do. There was a landmark study that came out in 2020 that shows if you do a series of 60 hyperbaric treatments, it actually added about 25 years of life back onto
Oh,
your
wow.
telomeres, the tails of your DNA. So every year we age, they get shorter. And if you have really good exercise and diet and rest, you can slow that process down or maybe get it to stop for a little bit. But nothing's really shown to put life back on it. And so now we're starting to get all the biohackers in of like, how do I live longer, live better? Yes, it treats wounds. How do I never get one?
Yeah. Okay. Okay. That pro pro preventative. That,
Prophylactically,
yeah,
yeah.
prophylactic. That's it. That's it. That's the word. And where can the viewers, listeners, find you, and how can they best connect with you?
Yeah, so we're at underpressure.com or at under pressure hyperbarics on social media. There's links there to reach out and DM, and usually you get me or someone pretty high on my team pretty accessibly. We're really passionate about helping people get access to this therapy all over the world and safely. It's really emerging everywhere as people are recognizing what the therapy is and how it can do it. But there's also a lot of these chambers that aren't as safely rated being put out there, and so making sure you're in one that's been properly tested to, be pressurized repeatedly. You kind of think of the Titan, that submersible that didn't make it to the Titanic the 5th time. It made it 4 times, but not the 5th. You wanna make sure you're in the right hyperbaric chamber because 'cause we're doing a lot of the same stresses to the structure.
Fantastic. Well, for the listeners and viewers, I'll put all those links that Nicole mentioned into the show notes, so you can go directly and click on the show notes. And I really want to thank you for coming on the show today, Nicole, and enlightening and enhancing the well-being of the listeners and viewers.
Appreciate it. Thank you. Thanks for having me.
You're welcome. And to people that might be under, some sort of traumatic injury, or if they're wanting some support, co-support along with their radiation or chemotherapy, or they're just wanting to biohack their way into longer life, please share this episode far and wide with them so we can help more people. Thank you.